As always, it is a pleasure to be here. For those that do not know, my name is Ted Oster. I am Vice President of Sales for Synergy Dental Partners. We are the largest dental buying club in the country. It is our job to preserve independent dentistry by offering DSO pricing to independent dentists on dental supplies, lab fees, even clear aligners. And boy, are we lucky as we are co-sponsoring this event with Care Credit, which is the gold standard of third-party financing when it comes to the medical dental world. We are co-sponsoring with ClearCorrect of the Straumann Group. Again, just the gold standard of, I would say, aligners, I would say implants everywhere. I am blessed that Monica Moore is here. And of course, Dr. Avi Patel, who is, I mean, my goodness, the clear aligner advisor himself. As many of you know, he's a general dentist turned educator. He helps GPs start and grow aligner cases confidently. Look, even if you're brand new, check out what Dr. Patel's got to say. He's the man. Over 200 doctors trained, over $9 million plus in aligner revenue generated. Uh, that's pretty incredible. And Dr. Patel, with all that being said, please take it away.
Thanks for the intro, Ted. I appreciate it. Everybody else who's here, thanks for joining us. I'm very excited and very passionate about these topics that we're going to be going over. And that being said, it's going to be a lot of me talking, and obviously none of your guys' mics are on. So I would appreciate some participation in the chat. So just to make sure that the chat is working, if you guys could just go ahead and just type and let us know, what brand of aligners are you using? What brand of aligners are you using? And if you're not using any, you could just say none. But just want to make sure that the chat's working. And I've done a handful of these webinars before, and it gets really awkward when I ask questions and if nobody types in the chat after. So full disclosure, there's going to be times throughout this where I will ask you guys a question just to see if what I'm saying is resonating. Or if it is, just a pointed question in general. So all participation is graciously welcomed. Thank you. Oh yeah, so we got some activity here. So Dr. Ajagbi, Invisalign. We've got Catherine with Sure Smile. Okay, awesome. Invisalign. Okay, anybody out here that maybe hasn't started yet, maybe not using any systems yet, and they're here as kind of a first step? If you could let us know in the chat. I know there's more than 3 of you guys here, so if you guys could just let me know. Awesome. Okay. Never use a system. Appreciate the honesty, Greg. No worries. The goal tonight is to share not only strategies and frameworks, but actionable tips for you guys. So with that being said, I'm going to go ahead and get into it. First and foremost, have to show this slide just so you guys are aware. And awesome. So for those of you who don't know me, I'm Dr. Avi Patel. I'm a dentist and a leading clear aligner educator. Before we dive in, I just want to share with you guys why aligners are a great procedure to offer. So first and foremost, it's the fastest growing procedure in dentistry, and only 10% of dentists are offering it properly. So that actually means there's a massive opportunity that's in front of us. It's a procedure that also caters to the 80-20 rule of your patient population. And the more that you serve, the more impact that you are going to ultimately have. And so today, I'm going to share with you guys the Win with Aligners method. And so what it does is it consists of 3 parts that you got to be familiar with. The first is how to prevent posterior open bites from happening. Second is a profitable protocol. And the third is avoiding costly mistakes. And so if you guys follow these 3 simple steps, you will be able to profitably and confidently offer aligners to your patients while decreasing chair time. And I'm going to walk you through exactly what you need for these. So how did this come to be? So in my first 6 months of offering aligners, I started over 50 cases, and this led to me generating over $500,000 from aligners alone. This is a screenshot of the numbers just to show you guys the proof. And what's crazy is I achieved all of this in a blue-collar 20-year-old practice, spending little to no chair time with most of these patients. took all these strategies that I learned from case selection, case acceptance, troubleshooting, and everything you can think of. And I took it and I bundled it up into my program Aligner Blueprint. Now, as Ted has mentioned, we've helped countless dentists go on to implement this in their practices. One of those is Dr. Chris Celadon. So he started back in 2022, and he went on to triple the revenue that he was bringing in from aligners alone, which is very impressive. But it wasn't always like this. See, I was excited and optimistic for my career as a dentist, and I wanted to help as many people as I could. And I wanted to make a lot of money while I did it, while not having to work as many days. The thing is that couldn't be farther from my reality. I was working long days, 6 days a week. I was not making that much money. My loans were piling up. My nose would be dented from wearing the mask all day because I'd be jumping back and forth from op to op with the full schedule, barely having enough time to drink water. I'm sure this has happened to most of you guys here. And I would leave work just feeling exhausted. And that's a picture of me there on my way to work. And you can tell I was thrilled to be going to work. But all jokes aside, this was an accurate representation of how I felt at the time. It was 2020. I'd lost my passion for dentistry. Honestly, I felt dead inside when I was practicing, and wearing the mask was a good way for me to just cover up my true emotions. And this is where I came to realize that I was burnt out on dentistry. And so you would think that by me working a lot, that meant that I was making a lot of money. Wrong. I was doing bread and butter dentistry, and you can see here, my crown preps, pretty nice, right? Well, those can only get you so far from a financial standpoint. And honestly, I was getting bored of them. And so even as a dentist, I was looking for additional ways to make ends meet, to the point where I even drove Uber Eats for a short period of time. And then things changed. My wife and I packed up all of our stuff. We moved across the country to Austin, Texas. I found a mentor, and then I went on to learn how to do aligners. And this is where I started my first 50 cases in 6 months. And I've gone on to do hundreds of cases since. The cool part is I was able to help guide my patients through transformations like these predictably and efficiently. And this reignited a surge of passion back into dentistry. So then I continued to invest in myself and education to continue to grow. Then I started teaching colleagues, created a consulting business. I helped doctors implement aligners. I was making a real impact in the industry. And I was actually voted 2024 Dentist Influencer of the Year by my colleagues. This opened the door to making an even bigger impact, to be able to speak on stages. And on this training, whether you're a dental practice owner or a high achieving associate, you are going to get a detailed breakdown of how to win with aligners. This is Dr. Yu. He's a dentist who was offering aligners, but he didn't have a system to follow to predictably start cases. And he was wasting a lot of chair time with multiple visits before patients ever said yes to the treatment. I shared the profitable protocol with him, as well as the concept of first appointment profits, and he implemented it and he got these results. He ended up starting 2 cases within a week of us speaking, and he said that it altered the course of his life, and he is hooked on aligners now. And so this is exactly what I'm going to walk you guys through today. And so quick note, every principle and technique that I'm going to talk about, they're brand agnostic. So I know a bunch of you guys are in here, you've used different systems. You can take everything that I'm going to go over and apply it to all brands. Now, I want to ask you guys a question. Have you ever experienced creating a posterior open bite for your patients? Type yes in the chat if you have. There's no judgment. If you haven't done a posterior open bite or gotten one yet, you can just say no. But would love to know where you guys are at in your journeys on this topic of posterior open bites. Okay, so this is one of those awkward moments I was telling you guys about, where if you don't respond, then I'm just kind of sitting here waiting. Thank you, Dr. Tucker, for the honesty. Yes, okay, you've experienced a posterior open bite. Awesome. So me too. But for those of you who have, right, I know the feeling. It is not fun. And for those of you who have never had one, congratulations. Although just know that it happens to the best of us. And for those of you that are sitting there wondering, what on earth is a posterior open bite and why are dentists so afraid of them? Well, this is what it looks like. Okay. Posterior open bites are when the back teeth don't touch when the mouth is supposed to be closed, right? Meaning there's a gap there. And dentists worry about these with aligner treatments because aligners can sometimes cause unintentional tooth movements. And so if not managed properly, the back teeth may lose contact, making chewing difficult and the bite unstable. And this can be very difficult to correct. So this is a case that I did, and it was my first posterior open bite ever. On top of them being hard to correct, they're even worse because they end up taking up more chair time and more trays. And so this ultimately leads to the case not being profitable. And this is important. And this is why I'm starting with this concept, because if you don't know how to profitably offer aligners, you are not going to be successful with this procedure. So here's my big screw up, the posterior open bite case. So this patient wanted to improve their crowding so that way they could floss better. Okay, that was the chief complaint. I didn't listen to my mentor at the time about not moving molars. I listened to one of the supporting orthodontists with the clear aligner company that I was working with at the time. I'm not going to name any names, but I followed their protocols. We resolved the crowding, as you can see on the top, but we got a posterior open bite. So what did I do? I did what any general dentist would do. I panicked. I freaked out. I texted my mentor. I was like, what in the world happened? How do I fix this? What do I say? She told me, just calm down. She told me to calm down. And then we walked through figuring out how to fix it. So in this case, a couple things happened. First of all, the molars tipped instead of actually rotating and translating. And then we also didn't get all of the planned anterior intrusion in the teeth. And so how did we fix this? Well, I took off all the attachments. I put on horizontal attachments on the molars, and then I planned for pure extrusion to try to get those teeth to come back into occlusion. I also did some IPR on the anterior, and I planned for more anterior intrusion. And luckily, we got it resolved. But it scared the crap out of me. So the thing is I didn't let this case define me as a clinician, because I've had several other successful cases under my belt, but I'd be lying if I said that I was not shaken up about this. And I know that some of you guys probably have been too. And so this is when I learned my lesson to be intentional about what teeth to move and when. But how do we even prevent something like this from happening in the first place, right? So fun fact, posterior open bites don't just happen out of thin air, okay? There's 4 ways that they can happen. And if it does happen, first of all, do not panic, okay? It's the worst thing you can do. So if you have a posterior open bite, you got to stop and figure out how it happened. Depending on how it happened is going to determine how you're going to fix it. So one way that a posterior open bite can happen is from passive intrusion on the aligners. So if you had passive intrusion, you would resolve it by cutting the trays. Okay, you probably have heard of this. Some people have mentioned, oh, just cut the trays in the posterior and then let the teeth drop down and touch. So that's one way to do it if passive intrusion was the cause. You can avoid this altogether by putting bite ramps on your cases. And so what that'll do is it ensures that the posterior teeth are not coming into occlusion with each other. And then that is what ultimately causes that passive intrusion. Okay, the second reason for posterior open bite is an anterior interference. And so this is super common in deep bite cases, especially when you don't get all of the planned intrusion. So you see that red area there in the front on that incisor. So that's showing us that there is a heavy contact there. And that area is actually hitting before the posteriors do. So one way to fix this is you just remove the interference with like a diamond football burr. And that's just called equilibrating the bite. So if that interference is significant, then what you have to do is IPR in the anterior. And then also intrude those anteriors, and then simultaneously plan to extrude those posterior teeth. That's one way to do it. Another way, if it is super significant and you can't correct it that way, then you would have to look into restoring those posterior teeth. This is also a case or a scenario where you could involve elastics to try to get more force on those teeth to get them to come back into occlusion. But again, this is all coming from an anterior interference. Another really big reason for posterior open bites is what's called molar tipping. And so how do you avoid this? Don't move the molars from the beginning, right? And so what happens is when you try to buccally translate a molar or maxillary molar, the trays are putting a force on the palatal surface of the crown of the tooth, like you see there with the blue arrow. So in a perfect world, the tooth would transit to the buccal like that, right? It just pops right over. Awesome. The thing is this doesn't happen in real life. So in reality, that palatal root exists and it acts as a leverage point, and then that tooth ends up tipping out instead of translating. And so that is how you get the posterior open bite. So if the tooth tipped, you can't get them to go lingual again. It's very difficult to do so. And so at this point, you're going to want to try to do pure extrusion to get that to come back down and occlude. In this scenario, if your molars tipped, do not cut the trays, because if you do, then what's going to happen is that central fossa of the tipped out molar is going to extrude down into the central groove of the mandibular molar, and then your posterior open bite is going to be stuck. And the fourth way is an iatrogenic posterior open bite. So this is what happens when you try to constrict an arch by distalizing canines. So usually if there's space distal to the canines and you're constricting that arch, what'll happen is the posterior teeth will try to move anteriorly and the anterior teeth will try to move posteriorly. And so a way to avoid this would be planning by putting on what are called G6 attachments on premolars and molars when constricting the arch. Or for most aligner brands, you want to just ensure that there is a counteractive force being placed on the posterior teeth, which will prevent them from trying to actually close that space. And so this is all stuff that can be happen when you're communicating with the techs. Awesome. So now that we have gone over how to prevent posterior open bites, it's time to talk about the profitable protocol. So what makes aligners profitable? Now, there's several reasons why they're a profitable procedure. One of the reasons is due to the current imbalance between supply and demand. We're all dentists here, so I'm going to assume most of us didn't do too well in economics in school. I didn't. So I'm going to break this down real quick. So in the case related to the aligner market, the supply is the number of dentists who offer aligners. The demand is the number of patients who want it. And when demand goes up and supply goes down, the prices go up. When demand goes down and supply is high, prices go down. So Uber does a phenomenal job of showing this in effect. So if anybody has experienced surge pricing, that's exactly what's going on. So surge pricing is when you're in an area where there's a lot of riders who are looking for rides, but there's not enough drivers. So in this case, supply is low, demand is high. So what happens? Price goes up, right? Similar situation for aligners right now. The demand is at an all-time high. And everybody can say thank you to Align because they have poured hundreds of millions of dollars into marketing over the last 10 years to educate the public on the benefits of plastic trays moving teeth. We can also say thank you to Smile Direct Club. They have also come and gone for a variety of reasons, but they have also dumped in millions of dollars into educating the public. But the other thing that they've done is they've abandoned millions of patients in the middle of and at the start of their treatment. And so simply put, people not only need this treatment, they want it. And so for reference, there's 300 million prospective patients, and there were only 1 million aligner starts in 2023. That's insane. So 299 million patients need and want this treatment. And the thing is you don't even need to spend a dime on marketing to start attracting those patients to your office, because like I said, Align and Smile Direct Club have already done that for you. You just got to open your eyes and your mouth in your practice and start identifying cases and talking about it. Because a good amount of those 300 million patients who need the treatment, they're coming into your office every single day. So this is where I'll just ask a question to you guys. Please type in the chat. Are you talking about aligners in your practice every single day? Just type yes or no. Again, this is a safe space. There's no judgment, but are you talking about aligners every day in your practice? Yes, amazing. No, totally fine. Totally fine. Appreciate the honesty. Awesome. Yes, yes, yes. There we go. Love to see it. Love to see it, guys. Okay. So for those of you who are not talking about it, you got to start every single day. Okay. And the very simple thing to do can lead to actually a lot of case starts. So that's very exciting. And if you think that's exciting, wait until you hear this. So since the demand is extremely high, guess what? The supply, it's nowhere near the level of the demand. And a couple reasons play into that. So one, this isn't something that was taught in dental school. So every dentist that's coming out, most of them have no education on it. And like any dentist, if you don't know how to do something well, you're not going to do it. Then you have the ones that go on and they pay for some basic level training. Again, look, not here to badmouth anybody, but almost every dentist I speak to said that they leave this training certification and they're usually clueless on how to do the procedure, right? So it's not that much confidence coming from that. But what does this add up to? So there's about 200,000 dentists in the country, with 12,000 of them doing 1 or 2 cases a month, and only 3,000 are doing 10 or more a month. And so simply put, if you start doing aligners and you learn to do them in a profitable way, you can have a leg up on the other 197,000 dentists who are doing it all wrong. And staying on this topic of profitability and money, there's a list of the average price of dental procedures, okay? And so aligners are classified as high ticket because of the price that you can charge. You can charge anywhere from $4,000 to $7,000. If you take the average, let's call it $5,500 per case, right? That's over 5 times the amount of the average procedure that you're offering in the office. And so imagine doing just 2 or 3 cases a month on top of what you're already doing. That'd be pretty nice, right? So the biggest benefit of aligners, in my opinion, is the fact that there's little to no doctor chair time when you're doing it the right way. And so you do this by having a proven system to capitalize on first appointment profits. So you want to leverage strategic scheduling to maximize this efficiency. And what you have to do is follow the 6 months in, 6 out protocol, and delegate as much as possible to your team. So the biggest mistake with scheduling is the come back for a consult appointment. Okay, it is the biggest waste of time, and it adds an entire hour of chair time that's just not necessary. You want to have your conversations during the hygiene exam, okay? And you want to have a conversation about how your patients can benefit from it. When they say that they're excited and this is something that they're interested in, you say, cool, we'll send off your scan to the lab, we'll get you a video walkthrough of the case, and then we'll just bring you back when it's ready, and then we can go through it together, and I can answer any questions that you may have about it. So this is probably something in a similar workflow that what some of you guys are doing. And if it is, that's okay. But what it is you've got to stop, because it is a waste of time, right? When you have this conversation in the chair with the patient in hygiene, they're ready to go, right? And you can close them in hygiene. You can start them. It's called the first appointment profits. It's the same concept as same day dentistry. You had the conversation, you identified their problems, you walk them through the consequences and the solution. They understand, they're ready to go. The next step is just getting them over to the treatment coordinator to go over finances. And then they just tell them that they will see them in about 4 to 5 weeks when the trays are ready to go, right? That is how you can remove that consultation appointment. Remember Dr. Yu showed you guys him in the beginning? So he used this strategy and he got 2 case starts immediately. He said it right there. I sold 2 cases after I implemented this, just asked during hygiene checks if they wanted to align their teeth. That's it. No consults, closing cases in hygiene. This is how you stop wasting chair time. And so some of you may be concerned about not being able to close cases in hygiene because you don't know how long the treatment will be if the patient asks, right? The same thing that I used to think about. Like I didn't want to start them in hygiene because I just wanted to know how many aligners, right? It's going to take. Every case is different. Well, if the patient asks for an estimate, this is something that I learned. If the patient asks for an estimate on how long the treatment will be, give them an estimate. Just say it'll be around 6 to 8 months, right? Because, and you can confidently say this when you follow a framework of case selection, because you know that if you can treat them, you're not taking on crazy cases, right? Because you have a specific type of case selection that you're following. And that is what allows you to have the confidence to give an estimate of treatment. And that's all the patient wants at the end of the day. So this is Dr. Rishi. He was new to aligners. He made the same mistake most dentists do with the consult appointments. And this is what he had to say after he implemented this. The first appointment profits concept is magical. I used to hesitate whenever patients asked how long treatment would be and have them come back for a consult and they never showed. But now I tell them estimated treatment time and answer all their questions on the spot, and case acceptance has increased significantly. It's been a game changer. So, did you know that there's a lot of doctors making their patients be in treatment longer without even knowing it? So this directly ends up increasing chair time and decreasing profitability. And if you make this one change, you can save 2 months of treatment for your patients and still get a great result. I know, shocking. So regardless of what you've been taught or what you know, wear time for trays today for almost all brands is going to be 7 days, right? So 1 week, it's not 10 days, it's not 14, 7. And the reason why is because if the default amount of movement per tray is going to be right around 0.25 millimeters. And you can adjust this setting in your clinical preferences based on, all brands give you this ability. And so if you get it down to 0.25, wearing trays for 7 days at a time, it is safe for this speed. Now, let's play this out. So if you're having your patients wear trays for longer than 7 days, this is what it looks like in terms of treatment length. Let's say the treatment is 20 trays and you're doing 10-day wear time. That's 200 days. If it's 7 days, that's 140. So you save 60 days of treatment or 2 months on average. Okay, so now that you know what makes aligners profitable, let's get into how you can profitably offer them. And so this is where I say to follow the profitable protocol. And I came up with this after experiencing all the wasted chair time, the missed opportunities and learning curves that we discussed earlier. And this protocol consists of the 6 in, 6 out strategy, the easy start method, and the team treat approach. This is a breakdown of what it looks like in terms of chair time and revenue. So doing some math here again, you can get an idea of how much you can make per chair time. Traditional ortho takes a lot of visits, a lot of chair time, and that's why ortho offices physically look different than GP offices, right? If you've ever been in an orthodontic office, they've got like 10 to 20 bays. They're in and out very quickly, not spending that much time with the patients. It's mainly their team, right? The ortho assistant is the one doing a lot of the work, and that is by design. With aligners, it can be a little bit different. I have seen doctors do it successfully out of a 2-op practice, and they still do very well. And so playing this out, each case is around $5,500. The lab bill around $1,500. So it's about $4,000 profit per case. Now, for the appointments. Cases that you should be treating should take around 20 trays, and you can expect, call it 1 round of refinements. All right. So let's run that scenario out from a scheduling standpoint and where the time allocation is. So let's assume you've already made the change, you took action. Now you're closing cases while they're in the hygiene chair, right? New patient exams or recall exams. So that's not counting against doctor chair time. Doctor chair time starts at the initial visit, right? 90 minutes. The patients get all their trays. Then you've got the 30-minute IPR appointment or checkup about 6 to 8 weeks later. And then a 15-minute checkup, call it 6 to 8 weeks later. And then the final eval, 15 minutes for scan for refinement. You bring them back for an hour, you deliver the trays, you add new attachments. Then you get your final evaluation for 30 minutes, scan for retainers, remove attachments, and they pop back in for a 15-minute retainer delivery appointment. Total chair time, 4 hours, 15 minutes. That is about $941 per hour of chair time profit. Not to mention the physical labor that you're doing, right? Remember, there's not that much physical labor. You're polishing off attachments and you're polishing between teeth, right? Doing some IPR and you're bonding composite to the surface of these teeth. From a profitability standpoint, pretty solid. Of course, you can streamline this even further by leveraging the home monitoring and all that, and only having patient come in for initial delivery, IPR, and final eval. But even if you're sticking to this schedule of having the patients come in, you can still be pretty profitable when it comes to chair time and production. And so the way to have this nice downstream effect is to follow the 6 in, 6 out strategy. So this is where you only treat cases that can be done in around 6 months. And what that does is it helps optimize cases to stay in the green in regards to chair time profitability. And these cases are going to be more predictable, right? And then you're also going to get higher compliance from your patients with better results. And I say this because I've been stuck with cases that were longer and it wasn't fun for anyone. and almost none of the patients were happy afterwards. So this is a case of an example of what not to do. I did not follow the 6 in, 6 out strategy. And it was after this case that I made a promise to myself that I would stick to it to ensure that my patients get the best experience possible. And so that I also still enjoy doing it. I'm going to break this case down in just a bit. Before we get to that, I just want to show you guys what are the types of cases that you should be taking on to stay in the 6 in, 6 out range. So the first thing, whenever you look at a case, you want to consider and classify the patient's molar relationship and occlusion. And the two types of cases you want to treat are class 1 and class 2 adult cases with misalignment in the anterior. The next thing you want to look at would be the position of the rest of the teeth and classify them as a spacing, crowding, or combination case, right? When you're starting out, you're going to be pretty good to take on the mild to moderate spacing and crowding cases. Cases that have crowding and spacing in both arches are going to be easier to treat than cases that only have one arch with crowding or spacing. I also recommend that you treat cases with less than 4 millimeters of deep bite. If it's got more than 4, it will be a challenging case, as mandibular anterior intrusion is the primary movement that you're trying to get to solve for these cases, and it's one of the hardest ones to achieve. Minor anterior cross bites are also good cases to treat. An anterior open bite, you can predictably correct these with clear aligners as well. You would be doing controlled extrusion to improve that vertical alignment there. Dr. Kevin Chang, he has gone in and used a 6 in, 6 out strategy, and this is how it has totally transformed the way he looks at dentistry. I get excited about it every time a patient signs up. It's all about case selection. So as soon as I see a case I can do, or the patient can benefit from, I can't stop talking about it. Now, the biggest thing that has been shown is compliance drops significantly after the 6 to 8 month period. And when compliance drops, teeth don't end up where you want them to be, right? Because if the patient doesn't work, trace doesn't work. Now, treatment takes longer because then you have to do more rounds of refinement. The patients are unhappy. They say the treatment doesn't work. They get upset. You get sad and feel responsible for this, but it wasn't your fault. They didn't wear the trays. This is called aligner fatigue. However, if you follow the 6 in, 6 out strategy to begin with, right? Like if you just did that, you would have avoided the situation altogether. So the next aspect of the profitable protocol is the easy start method, which is meant to boost case acceptance, to capitalize on same-day starts by decreasing the upfront financial friction. I came up with this method after being told by so many patients that they couldn't afford treatment. Yet most of them had nice cars, they went on vacations, they had iPhones, and they had a bunch of other things that they paid several thousands of dollars for. Well, why is that? Well, I was making the mistake that most doctors make. We want all the money up front, right? Or at least enough to cover the lab bill. So the problem is that is a couple $1,000s on the spot, right? And yes, people have it, but not everybody wants to just spend it right then and there. And so you got to kind of ask yourself, when is the last time that you just paid for something over $5,000 outright, right? Now, when I stopped asking for all the money up front and started using the easy start method, the financial friction to actually get treatment going was removed and case acceptance went through the roof. So this is where having flexible, easy payment options is key. Everybody is conditioned to subscription these days, right? Netflix, iPhone, online shopping, travel agencies, pretty much everything. So why should aligners be different? So I'm going to walk you through how to use the easy start method. Let's take a situation. Let's look at the actual situation just to get some perspective. The dental office is a stressful place, right? We all agree it's pretty stressful in there. Thinking about money is also stressful. And so what I'm proposing is you just separate the two events. So take $250 down to allow the doctor to start working on the case and to get financial buy-in from the patient. And then you would also show the patient the total amount for their payment options, like third-party financing from a place like CareCredit, right? But then you have to remember that there's two decisions that this patient needs to make, and they don't need to make them at the same time. They need to decide if they need this treatment, and then they need to decide how they're going to pay for it, right? They know they need it. So they already made that decision and they sealed that decision by paying $250. Now they have a month to decide which option they go with, and then they finalize it at the trade delivery appointment. So this gives them time to actually move things around financially and plan for it, talk to their spouse, and all the other things that you hear patients tell you whenever they say that they need time to think about it, right? Because they know that they're doing the treatment. And so when they have the conversations at home, it's totally different. It's through the lens of, hey, I need this treatment. How can we make this work? How can we make this work financially, right? Versus them asking for permission or trying to relay all the concepts that you told them to their spouse. And most patients don't remember everything we say. So they basically give incomplete information to somebody else. And then that person has to like make a decision off of that. And so that's why a lot of patients just don't move forward with treatment. It's not because you did anything wrong. It's just because they're trying to basically show all the reasons why they need it. And it's totally different versus if they just say, hey, I really need this treatment. How can we make this work financially? Now they're brainstorming. They're figuring out how to pay for it versus figuring out if it's something that needs to be done or not, right? So you got to remember, you're helping them move forward to a healthier mouth, and you're saving them money in the long term because their dental problems are only going to get more expensive over time. We all know this. Dentistry does not get cheaper over time. Now, already know what's in some of your minds. You're thinking like, well, what if the patient backs out and bails from treatment? Totally valid concern, but there's nothing you should be concerned about. First of all, they should be signing off on a treatment plan that binds them to committing to treatment. You're just allowing them a few weeks to decide how they're going to pay. So let's run these scenarios through. If they back out before you accept the treatment plan, you can give them a full refund, right? They would have violated a signed agreement. However, you can just give them a full refund because you didn't have to pay for the lab bill. If they back out after you submit the treatment plan and you're on the hook for the lab bill, you can simply pass that amount on to them. Or you can talk to your rep and see if they'll credit it for you. Reps have helped me out before, but I'll tell you this, if the first time you talk to your rep is to ask them for a credit on a case, not a good look. You want to start talking to your rep early and often. Get them on your side. Let them see how you're trying. Include them in some of the decisions you're making. They're a really valuable resource. And if you have a relationship with them, if a patient ever backs out and you're in the situation, they would be way more willing and likely to actually help you out and give you a credit. Okay. Another thing is, after talking to several high-performing aligner docs across the industry, they have all noticed that there has not been an increase in number of patients who back out of treatment compared to when they pay more upfront or going through this method, right? Because again, some patients back out. That happens probably right now with whatever method you're using. There's a small percentage of patients that do. But what I'm trying to say is that percentage does not go up by switching to this method. If anything goes up, it's the number of cases started because you're decreasing that financial friction. This is Dr. Bethany. Shared the easy method with her, and this is what she had to say. It's genius. Patients are way more willing to start treatment the same day, and we have seen a boost in case acceptance ever since we started implementing it. Okay. Now, the third and most important aspect of the profitable protocol is the team treat approach. So when I first started out with aligners, I was a man on a mission. The reality was my team wasn't jumping at the bit to support me. Maybe one person was, but everyone else was just wanting to keep things status quo. And I'm sure you guys can relate whenever you bring new ideas, procedures, and instruments to the office, right? Well, I refused to let them bring me down, so I did everything. And this was great because I was able to have success since I was doing every single step and I could do it to my best ability. But this was bad because it was by no means sustainable or scalable, and it led me to actually burn out very quickly. And I remember the day it happened too. We had a full column of patients and I was just humming that day. Me and my assistant were running 3 chairs. I was in multiple places at once. It felt like a superhuman. But while I was bouncing between chairs and talking to patients about treatment and actually doing treatment on patients, I walked into an op and I started talking to the patient about how we could improve their teeth with aligners. And she just looked at me and she said, "You already talked to me about this." And I said I was interested. And nobody has talked to me about pricing yet. And I've been here for over an hour, but you don't seem to remember me or what we discussed. And I can tell this place is chaotic. I don't feel comfortable here. I think I'm going to go somewhere else to get treatment. So she got up and left. This was the biggest wake up call for me. I'd done everything right. The patient wanted the treatment. And because I didn't take the time to get my team on board, and I thought that I needed to do everything, I lost the patient for good. So I took the weekend to just think about how I could improve and change things. And this is where I realized if I could try to just create a system and map out the roles, responsibilities, and tasks, and then teach my team how to just be one part of the system, this would be so much easier. So that's what I did. I went in that week and I took the time to sit down and figure out the pain points that was preventing them from getting started. And then I found a solution to alleviate their problems. And once I did that, once they saw that I cared about their situations, the vibe completely changed. They were all hands on deck to do their part in offering aligners to our patients. And it's been the best way for us to scale the practice, and it makes it so much easier to do. So the team treat approach is a clear system that allows each team member to know their integral role in the patient's entire journey from start to finish. Your dental assistant, they're going to prepare the patient for aligner consultations, take records, and they're going to assist the dentist in delivering and adjusting aligners, ensuring the patient is comfortable. Your hygienist, they're going to educate the patients on the oral health benefits of aligner treatment, and they're going to monitor the hygiene and provide preventative care during treatment. The treatment coordinator, they explain treatment plans and the financial options to patients. And they also ensure patients understand the process and schedule follow-up appointments. Your front desk, they're going to manage scheduling for consults and follow-ups. They're the first point of contact for patient inquiries and coordination with other team members. Your office manager, they're overseeing the overall workflow and they're ensuring that this process is streamlined. They're going to track treatment progress and ensure that all team members are aligned in communication and goals. And then you, the dentist, you diagnose and you create the treatment plans. You're going to monitor the progress and make necessary adjustments for optimal results. So now that you guys know how to utilize a proper protocol, let's go over some of the biggest clinical mistakes that doctors make and how to avoid them. Are you guys still with me? And is this helpful? Before I move forward, I just want to make sure that we're all in the same place. Awesome. There we go. Thank you. I'm glad you guys are liking this. Thank you, thank you, thank you. Cool. All right. So when someone starts off with aligners, it's not all roses. Okay. So I have taught over 190 dentists how to do aligners, and I see these mistakes as the most common ones. They choose cases that take forever. They say yes to every patient just because they ask. They move teeth that they shouldn't. They're not making modifications during the case setup. Big, big, big one. They're not having a protocol to follow and have cases end up with problems. They're inefficiently scheduling patient appointments. And if any of these sound like something you've done, don't worry, I'm going to help you through this, okay? Now, when I first started with aligners, I came out of the gates and I made the biggest mistake that almost every dentist makes. I took on a case that was way out of my league, mainly because I didn't know any better. Honestly, looking back, that's probably what it was. And it sucked up so much chair time that I was losing money by doing the case, which is everyone's nightmare, and it was my reality. And so this is that case. This patient wanted to improve the crowding and fix the deep bite because she said, I want to see more of my bottom teeth when I smile. So what did I do? I said, sure, we can do this. So let's go through this together. I'm going to point out everything that I did wrong. So first of all, it was a deep bite case with crowding. The deep bite was greater than 4 millimeters, right? It was class 2 division 1. Nothing wrong with that, but realistically, correcting class 2s in adults is very difficult and not that predictable to pull off. Now, the patient had a bridge from 13 to 15. So those were unmovable during treatment, right? You can't move bridges with aligners. And then the initial plan that came back, it said just 22 trays. Okay, cool. Pretty straightforward. We should be good here. Well, it ended up taking 18 months and it took 5 refinements. And while we were able to correct the crowding, right, the alignment looks great here, we came up short solving one of the patient's chief complaints. And the fact that her front teeth were still covered up by the top, that was an issue for her. And it was a huge lesson for me. So she eventually accepted the fact that we weren't going to be able to intrude those teeth anymore. And we both agreed to just finish the case. The thing is, I told the patient and I set realistic expectations from the beginning. And on almost every appointment, I try to tell them, like, intruding those anteriors is going to be very difficult. And I could not guarantee that we could get all of her teeth to show. Yet she wanted to try over and over and over again. And I'm happy that I was able to help her, but sometimes you have to know which cases to say no to if they're going to end up eating all of your chair time. And so knowing what I know now about improving deep bites, you can get some level of improvement. But since this was greater than 4 millimeters, I probably would have referred this case out just because of the length of time that this case will take in my chair and how much more efficient and effective it can be with an orthodontist. So now that you guys know the case that pretty much put me through the ringer there, here are all the cases that I refer, and I highly recommend that you do too, especially if you're just starting out, and definitely if you want to offer this procedure profitably. So bilateral posterior cross bites, don't even touch them, get them to ortho. Class 3s, deep bite cases greater than 4 millimeters, as well as teenagers, okay? I pretty much am only doing adult ortho. So my friend Irene gave me this. Check her out on Instagram. She's a hygienist. It's Tooth Life Irene, but she said this and it made me laugh. Aligners are like condoms. If you don't wear them, it won't work, right? So if profitability is what you're shooting for, don't treat teens. The main reason why I say this is because the success of this treatment is almost exclusively dependent on if the patient is compliant. If they don't wear the trays, it's not going to work. And teenagers are the worst at compliance. So if you take on teen cases, be prepared for several visits, revisions, lost trays, buttons that pop off, and don't say that I didn't warn you. Now, the next mistake I see doctors make is they love being a yes man or yes woman whenever patients ask if they can do aligners. Look, we all feel good when patients ask us to help them because helping people is one of the biggest reasons why we got into this profession. I understand that. And when you couple that with the fact that you have patients all day not wanting to be in the chair, right? And then the one patient comes in out of the blue and like, hey doc, can you please straighten my teeth? And then they smile and it looks like this. And you're like, we can, won't be easy though. And then they tell you, it's okay, doc, I trust you. I trust you. You got this, doc. I believe in you. I want you to do it. So then you do it. Well, I fell prey to this situation, clearly. That's why we're talking about it today. This is the case I showed you guys earlier, and I said I would review it. So at the time, the doctor that I was working with, he didn't do aligners, but he had a very, very long-standing patient population, and one of them really wanted the treatment. And so he asked me to do the case, or at least to take a look at it and to treat her if I could. So I did a consult with the patient, and I tried to make it as clear as possible that this would not be easy. And due to the severe crowding, I told her this is going to take a while to fix. And she didn't care. She wanted to go for it. And so I made the mistake that most dentists do, and I just went for it instead of referring. And then so 18 months, 81 trays, and 4 refinements later, you get this. Now, patient was happier because they had a healthier mouth, but they were definitely annoyed at how long the case took. And I was pretty annoyed too, because the case took way longer than expected, and it was a roller coaster of emotions the whole time. Now, I found peace in the fact that I was able to help improve the health of her mouth, even though I didn't make any money off this case, which is great and all, but it's not sustainable, especially when you have bills to pay. So don't make this a habit if you're doing stuff like that. The third mistake that doctors make is they're trying to move teeth that they shouldn't. And I say this, guys, because aligners are a tool. And with any tool, it has uses and limitations. Compare a screwdriver for this. Would using a screwdriver be efficient at hammering a screw into the wall or screwing it into the wall, right? You could probably take, of course, you could take the end of the screwdriver and maybe use brute force to hammer it in, but that's not what it was made to do. It was made to screw the screw in. So the same thing goes with aligners. This is plastic trying to move teeth inside bone. They can get the job done, but not for every tooth in the same way. So where am I getting at here? Molar movement, okay? Moving molars with aligners, it's not the most predictable thing to do, especially when starting out, and it takes a long time. My advice, don't move them unless they're lingually tilted and you're trying to upright them. That's predictable. You can do that all day. Don't try to buccally translate them or rotate them. Just leave them be. And so when you see molar movements like this on the tooth movement table in your cases, just kindly request them to remove the molar movement. What that does is it will create a chain reaction of other movements in the rest of the dentition. But those movements are probably going to be more predictable and it's going to save you headache and chair time. So I did this on a case. There was molar movement planned for expansion. Okay, the molars were planned to expand. However, the movement didn't actually express. And you can see it, right? The molars did not move in this case. The premolars did, right? The molars stayed the same. And so we ended up getting a fantastic result. And so this is where you can just say, I got lucky. And a lot of dentists out there are just getting lucky. But again, it was an early case that I did before I had protocols, and cases that end up like this is why so many doctors are out there doing aligners that actually don't know what they're doing, because they're just taking the first case that comes back and accepting it. And so they're getting results, but then sometimes they don't get results, right? And if that's you, I know you're not telling your patients, but don't worry, your secret is safe with me. So on that topic, the next biggest mistake that doctors make is they just assume that the plan that comes back from the tech is the one that they should do. I was alluding to this earlier, but I'm going to say it outright. Never, 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 ever approve the first plan that comes back from the lab. If you do, you're rolling the dice and you're almost guaranteeing yourself a nightmare. You have to modify your cases, guys. And trust me, I know it would be awesome if you could just scan a patient, submit the case, and then click accept. Like that would be an amazing world to live in, but that's just not how these aligner companies are structured right now. You have to, and it's because we're dealing with humans, right? You're the doctor. You got to assess the plan and make some modifications, whether it's swapping out attachments or eliminating certain movements that are unpredictable and planning for movements that are more predictable. These are the things you have to do to be an engaged aligner doc. And so these mistakes all add up to the fact that, right, when most docs are starting out, they don't really have a protocol. No one taught us this. We didn't know better, and that's okay. But when there's no protocol, it sets the stage for disaster to strike randomly. And one of those disasters are the dreaded posterior open bites. And that's what I fell prey to. So don't be like me. Learn from my mistakes, okay? The next mistake I'm going to share with you guys, one is bigger than just you. It's the one that your team is making as well. And it's not any of your faults. It's the fact that, again, you weren't taught how to do aligners, and you definitely weren't taught how to schedule patients efficiently for aligners. And when scheduling is inefficient, the patient experience plummets along with profitability. A huge inefficiency are scheduling patients when the attachments fall off. So for those of you watching who currently do aligners, just let me know in the chat, has an attachment ever fell off? Just, again, judgment-free zone. Don't be ashamed. It's happened to all of us, but I just want to see, just say yes if you've had an attachment fall off, or no, either one. Either one works. Thank you for the honesty, Doc. Thank you for the honesty. Yeah, so this happens, right? Like attachments fall off, that's a thing. Well, funny story, the first time it happened to me, I didn't know that was normal. I didn't even know what to do. So at the time, our front desk came up to me and they were just like, hey, Jamie's attachments fell off. What do we tell her? What do we do? And so I remember I felt like a failure. Like I thought we did something wrong. I thought we messed up. And it felt like the world was falling apart. Like, oh my gosh, an attachment fell off. Like, this is the worst thing. I'm the worst dentist. We don't know what we're doing. And it's kind of that imposter syndrome that kind of crept in, right? Because in the beginning, when you're doing something new, like you're kind of like, oh, like I got this. And then when something happens out of the ordinary, you're like, oh crap, what do I do here? So luckily, being resilient, right, came to our senses and we're like, let's just bring her in. So they brought her in, booked a whole hour for this appointment. God knows why, but booked an hour just so we could make sure that we needed to do what we need to do, right? It's like if you don't know, just block the time and take it and assess it. So the patient came in and they said that they fell off when they were eating and they just wanted it replaced. Easy enough. So we just took the tray that they were wearing. We went through a protocol. We never heard from them again. And the attachment was still there. Amazing. So clinically, everything was fine. But from a business standpoint, right, this was horrible because we just extended the chair time on this procedure, making it less profitable. So if you want to avoid these mistakes, you got to follow what I call the chair time standard. So it involves having standard times for scheduling these appointments based on the patient's needs. So 30 minutes non-doctor chair time for attachment placement, right? And what needs to be confirmed beforehand is the location on where the attachment fell off and the tray number, okay? This must be done before they arrive so that way you don't waste appointment time and your team can just replace the attachment. Too many people waste time making this appointment and ordering appointment. Okay. If a patient says my attachment fell off, and the next thing that the team does is have them come in, and then you're assessing which attachment came off so that you can then order and replace it. You don't want to do that. You want to have that all confirmed on the phone before, so you can take action before the patient is there. So look, we take the time to map out all types of appointments, and you should too, right? This way the team knows exactly what to do, how long to schedule these appointments, and ensure that you guys are maximizing chair time and workflow. So you're probably wondering, all right, what did you do differently to ensure that the attachments didn't fall off? Well, when you're doing attachments, isolation and contamination is key. So if there's even just a drop of saliva that gets on the tooth surface, that bond strength is going to weaken and your attachments are going to fall off. So just make sure that you isolate well. Use cotton rolls in the sulcus, wipe the teeth with gauze, and use something like an Optrogate to keep the lips out of the way, or an Isolite to keep the tongue and cheeks out of the way. For contamination, this might be news to some of you, but do not use the same micro brush on multiple areas. And I say this because the micro brush will collect saliva over time. And then you will notice that by the time you place your last quadrant of attachments, that bond strength will be weak and you'll have a lot of chair time wasted with reapplying attachments. So if you do these two things, you'll save a lot of time with this procedure. To make isolation even easier, this is a nice little pro for you guys. I like to work in quadrants. So you take the trays, cut them into the 4 quadrants when you do initial application. Okay, you can see there. This way you can focus on one quadrant at a time and really focus on that isolation. This is Dr. Simone Ellis. She's a huge fan of this method, and this is what she had to say. She said, ever since we started focusing on isolation, the number of patients calling to come in because their attachments fell off has dropped drastically. This has allowed for us to significantly decrease chair time with the liner. So guys, this stuff works. Now, that being said, can any of you see yourself implementing one of these simple strategies? So let me know in the chat. Awesome. Cool. Love it, love it, love it. Well, I am glad that that was helpful for you guys. Ted, Tori, I will let you guys take it from here. If any of you guys have questions, you can drop them in the Q&A. We will be getting to those in just a bit.
Yeah, Dr. Patel, that was absolutely fantastic. Monica, do you want to tell us a little bit about ClearCorrect? The Stroman Group, thank you so much for being here, just amongst the gold standard of just dentistry in general. Please, if you don't mind just shedding a little light on ClearCorrect.
Yeah, absolutely. And thank you for the opportunity. So, really great information shared here from Dr. Patel. So, very appreciative to be a part of this. And just want to know your members to know that as a preferred partner of Synergy, they do have benefits with ClearCorrect. So, we are Straumann Group owned. And everything that you've come to expect and know about Straumann Group in terms of being the gold standard, as you said earlier, Ted, is true of ClearCorrect. So I would welcome all of you to please, my contact information is on the slide in front of you, to please screenshot that and reach out to me. I would love to visit with you and just talk to you specifically about ClearCorrect and what the advantages are of ClearCorrect over maybe the current aligner system that you're using. And that is besides the fact that as a Synergy member, you save 25% off of ClearCorrect's retail pricing. And our retail pricing is already very competitive. And for some of the higher priced aligner systems, even at retail, we save you significantly. So on top of that, 25% as part of your Synergy benefits, we start talking about this lines right up with the profitability that Dr. Patel is talking about. So I would love to help you with that and lean into that a little bit. Are there any other questions? ClearCorrect specific, I welcome those.
Look, a couple of questions in the chat. Let's double check. There are a lot of clear aligner options out there. What sets ClearCorrect apart?
So that's a really great question and one I love to answer. So ClearCorrect offers just streamlined sets of case types. Number one, they give you flexibility and clarity when you're planning mild to complex treatments. It doesn't matter. We have a case type that fits it, but they're simple. They're easy to work with. You're not going to have to read pages and pages of terms and conditions to understand what is going to be best for that patient and for you. Secondly, our clear quartz material. It's a tri-layer material. It delivers optimal force retention and stain resistance. And then our high and flat trim line, which improves control and predictability. So the combination of those two, our high and flat trim line, which equates to less attachments for you, which equates to less chair time for you. And then the material delivering force retention, which is spread across the tooth instead of most of the time, like a scallop trim line is putting most of the force at the incisal edge of the tooth. So with the force retention being spread across the tooth, you're getting more predictable movement. So we're improving control and predictability, which also is a tremendous advantage and helps you, again, reduce chair time and achieve more efficient outcomes. Seamless integration into Straumann Group's open digital ecosystem. So you can maintain your preferred workflows and use the technology that best supports both diagnostics and case execution. So that's a big deal. Open platform. It doesn't matter the scanner that you're using. We want to support you with the scanner that best supports your practice, and we can receive scans from virtually any scanner on the market. And that puts you in the driver's seat. But really what sets us apart is our support. So we don't just ship you, your box of aligners and call it a day and wish you luck. We surround you with white glove onboarding, clinical guidance, and digital tools that will help streamline your workflows and help you grow confidently with clear aligners. So when you pair all of that with your Synergy partnership, it just becomes even more powerful. So you have access to exclusive pricing, which I already mentioned, 25% off of our retail pricing, curated onboarding, aligned support from local rep. There are remote reps. We have provider service teams, and then you have access to clinical advisors, which is a board of orthodontists that we have that can give you clinical direction when you run into cases where you want just a second set of eyes. So we give you a clear competitive edge through our partnership with Synergy, and especially in today's market. So anyway, that is that is it. I would love to connect with any one of you that would like to just learn more. You can schedule with me through a Calendly link. I don't know if that's actually on the slide there, Ted, but I'm happy to send it, or if they want to request that, and then they can schedule just at their own convenience what works for them. Happy to answer any questions anyone has. And just thank you for attending, and thank you Synergy for having me be a part of this, and thank you Dr. Patel for a great presentation.
Thank you, Monica. You mentioned scanners, and this question came in. Dr. Patel, maybe you want to take this. Do I need a scanner?
So with aligners, it helps. If you want to do, it depends on where you're at. If you want to get started, you don't necessarily need one to get started. But you do need one if you want to grow. And so I always encourage doctors, if you're just getting going, have a scanner in your plan. But first you need the education. Because if you have a scanner and you don't know how to do it, you're really just kind of sitting there, and it's just gonna be, you're not gonna have a way to actually, make good on that investment. So I always encourage doctors, I say, prioritize your education, get that rolling. Once you do that, you can literally start cases the next week, right? If it's the right education, and then use that money to invest in the scanner, and then it more than pays for itself. But yeah, that's kind of how I approach that question about if they need a scanner for aligners, because it does make the process much easier. But I understand it is an investment, but if you can get some wins and some cases started before then, even better.
That's great. I mean, you do have an online program. I'd imagine you go much deeper into this. Then you do have an in-person boot camp. And by the way, shameless plug, Synergy members do get discounts for both. And Dr. Patel, look, guys, please go look more into these. His online program is phenomenal. His Instagram, please check him out there. A ton of valuable information at Avi, AVI. So, please check him out. I'll wrap it in. I'll wrap it up.